And good morning.
Thank you, Mr. Chairman. Ms. DeLong, thank you for being here today and for the services NCMEC is providing to protect our nation's most vulnerable. Your team deals with truly horrific situations, and your efforts save lives. As more kids are online and using devices at a young age, there's certainly increased risk for abuse and exploitation. I also suspect this connected age presents new opportunities and capabilities to identify and locate a child that has gone missing. Can you discuss how the prevalence of technology in society has changed the way NCMEC conducts its vital work?
Thank you, Dr. Foxx, and thank you for your leadership and for having us here today. Technology does. It cuts both ways. It's certainly thrown accelerant on the issue of child sexual exploitation and made it a much larger problem than any of us ever realized. But it also provides the tools that we need to find missing children in ways that we couldn't have imagined 40 years ago, 10 years ago. By using many of the public and private partnerships that we have, we are able to use technology to meet audiences in different places. For instance, there's a company, GSTV. They're the ones, the gas station televisions, when you're pumping your gas. They actually donate more than 27,000 screens to feature missing children in a particular area. We've had recoveries while somebody's a captive audience pumping gas, then actually being shown images of children in that particular area. We use technology also to push out Amber Alerts, something that did not exist when we opened our doors. We are the designated secondary distributor of Amber Alerts. So when law enforcement in a particular state deem that a missing child is eligible for an Amber Alert, we are the ones who are pushing them to cell phones across the country in very geolocated areas. So with technology, in a simple way, on the missing child, it is allowing us to hyper-localize our search for missing children in a very noisy world, allowing members of the public to be focusing on the children that they have the highest likelihood of seeing.
Thank you very much. In your testimony, you mentioned that children involved in the foster care system go missing at an alarming rate. H.R. 5224, the Missing Children's Assistance Reauthorization Act, enhances NCMEC's ability to coordinate with the child welfare system and codifies reporting elements on children missing from state-sponsored care. Can you discuss some of the unique risks facing children in the child welfare system and how NCMEC works to protect this vulnerable population?
Thank you, Doctor. Yes, these children are often in child welfare because of traumatic experiences that they've lived through, and therefore there are many endangerments that might follow. Many of our missing children, a large number, who are missing from state care, may have endangerments such as mental health issues, substance abuse issues, maybe individuals that they're speaking with online. Very often will go to meet somebody that they believe is as a partner or go back to biological families. In terms of the education, what this Reauthorization Act will allow us to do is also provide more information in a very streamlined and strategic way to the child welfare agencies and professionals so they have the tools they need to recognize the signs and to know what they need to do in order to find that child. Working with us, one of the most important components is our recovery services program. It's something that didn't exist 5 years ago. Every child is unique. Every child has different endangerments. We have a very personalized response when a child is going to be recovered, trying to identify what their endangerments are, put a safety net behind them that when they are recovered, we can get them the services that they need.
Thank you again very much, and thank you for the work that you're doing. Mr. Chairman, I don't know if you saw on TV this weekend, John Walsh was on and talking about the Center for Missing and Exploited Children, and he's one of the reasons that we have this program. And he had retired, but he said he got back in the fray because primarily of the horrible immigration situation. And so I'm sad to see that, but happy that we have this program. Thank you, Mr. Chairman. I yield back.
Thank you very much, Madam Chair. Let's go to the great Commonwealth of Virginia for the ranking member on the Education and Workforce Committee, Representative Scott. Good morning, and